What is implantation bleeding and how does it differ from regular menstrual bleeding?
Hello everyone. Today, we're going to talk about a topic that can sometimes be a bit confusing: implantation bleeding. We'll discuss what it is and how it differs from your regular menstrual bleeding. This information can be especially helpful if you're trying to conceive or just want to understand your body better. So, let's dive in.
What is implantation bleeding?
Implantation bleeding is a light vaginal bleeding that occurs when a fertilized egg attaches itself to the lining of the uterus. This typically happens about 6 to 12 days after ovulation. Here are a few characteristics of implantation bleeding. It's lighter than regular menstrual bleeding. It often has a pink or brownish tint. It's usually short-lived, lasting just a few hours to a couple of days. Not all women experience it. It's entirely possible to be pregnant and not have implantation bleeding.
How does implantation bleeding differ from menstrual bleeding?
It's easy to mistake implantation bleeding for a light period, but here are some distinctions. 1. Timing. Implantation bleeding happens around the time you might expect your period, but it can occur a few days earlier. 2. Color. While menstrual blood is usually bright to dark red, implantation bleeding tends to be a lighter pink or brown. 3. Flow. Menstrual flow is typically heavier and lasts longer. Implantation bleeding is usually very light and might be noticeable only when wiping. 4. Duration. A menstrual period might last between 3 to 7 days, while implantation bleeding typically lasts up to 48 hours. 5. Cramping. While both can be associated with cramping, the cramps from implantation are generally milder and more localized.
Why is recognizing the difference important?
Knowing the difference between implantation and menstrual bleeding can be crucial for various reasons. If you're trying to conceive, recognizing implantation bleeding can be an early sign of pregnancy. Understanding your body's signals helps in tracking fertility and menstrual cycles. It assists in early pregnancy care, ensuring you make necessary lifestyle changes sooner rather than later. Understanding the nuances of our bodies is powerful. Whether you're on a conception journey or just curious, distinguishing between implantation and menstrual bleeding helps you stay in tune with your body. We hope this information has shed some light on the topic. Remember, every woman's experience is unique, and if you ever have concerns or questions, always consult with a healthcare professional. Stay informed and take care.